Hello, everyone, and welcome to United Way. Live United. I'm Terry Westerfield. And joining me today, I am so proud to have friends in from ViaLink 211. And I want to welcome to the program Marguerite Redwine, who is the CEO. Hello, Marguerite.
Hello, Terry.
It is so good to have you back. And Lavandra's here, Lavandra Dobbs. Lavandra is the Programs and Services Director for ViaLink 211. And Lavandra, you've been in the job now for a little while, but...
about 5.5 months.
But the first time you've come to visit us, so I am very glad you're taking time today.
Thank you.
And for anyone who listens to the show, we are mentioning 211 all the time. We talk about it being the 24/7 go-to information and referral line that you can call 211 to help whether hurricanes or your own personal everyday storms. It is that. It is so much more. In fact, ViaLink is one of United Way of Southeast Louisiana's, what we like to say, a community impact partner. And ViaLink provides information and referral, as I said, through that real easy number. Come on, ladies, say it with me. 211. It doesn't get more simple than that. And that number is also going to help you play an integral role in the statewide Louisiana 211 system. And this is utilized, especially when we're talking about crises such as hurricane season, and maybe there's, who knows, even during the last ice storms. There are so many things that 211 does for people on an everyday basis. And I think that's what's key. People don't realize the power that 211 has because it's about knowledge. Knowledge is power. 211 can connect you to the people or the position or the service that you need to help you get through life with your problems. So let's stop right there. And Marguerite, can we talk a little bit about maybe the history of it? Because we try to bring you on every year at least once and several times. But people, again, need to hear how 211 got started here.
Well, nationally, 211 was passed as a number that could be used for health and human services in 2000. And the leadership for this happening was the United Way Worldwide and our national affiliate, the Alliance of Information and Referral Systems. And I'm so happy to say that ViaLink, in partnership with the United Way, has provided this service since 2001. As a matter of fact, we were one of the first 20 areas to have the 211 service in the United States. And today, amazingly, as we were just discussing before we went on air, over 91% of the population of the United States has access to 211, and 56% of the people of Canada. So it's a phenomenon that is incredible. The maze of human services is getting so complex that people simply don't know where to turn. They know there must be help out there, but they think, I'm just overwhelmed. I need help with my utilities, or my teenage boy or girl is acting out. Where do I call? Where can I get help? Well, the whole idea is just simply dial 211 and we will be there to help you. Lavandra in a minute will give you an example of the kind of calls. We're really fortunate in this area that we are what we call a blended service. We provide the 211 information referral to community services that are vitally needed by people. And we are also a nationally certified crisis and suicide intervention crisis call center, as well as information and referral call center. And as you so aptly pointed out, Terry, we are here for everyday needs and for emergencies and disasters. Hurricanes, we're all familiar with that. Who would have ever expected the huge impact of the oil spill in the Gulf? We were there and handled many, many calls for that. There are tropical storms and now freeze storms that we're accustomed to. So we try to prepare for any emergency or disaster possible, and we do this in partnership with the United Way and many other key organizations in the community.
Well, can we talk and explain to people about how 211 works? And it's so simple. We said that earlier. But we struggle with this day in, day out, year in, year out. Folks, it's one of the numbers Don't let it get lost. It's not 411 with the information to get something else. It's not 311 for the city. It's 211. 211. By the fact that we're number 2 says we were there first. And it's important because, as you said, Marguerite, the services that exist out there through the nonprofit world and through governmental agencies and even some faith-based and otherwise, they all work together, bring these resources together for the betterment of the community and individuals. Anyone can access it at any time. And when you talk about a crisis, and I did too, your crisis may not be the same as someone else's. So there's everything from, as you said, maybe your teenage kids are acting out or you're having problems that way. Well, maybe it's you've lost a job. What do I do? And that is the beauty of what 211 can do to help, because of all those myriads of problems that anyone could have or any community could have. 211 can steer you in the right direction. And Margarita Lavandra, if you can go ahead and kind of explain, say somebody's called in and let's say I've called in and, oh my goodness, I'm a single mom and, oh my gosh, I've just been laid off. I don't know what I'm going to do. I'm worried about paying the rent. Oh my gosh, do I have enough food in the pantry?
Sure.
What happens? I dial 211 and...
Okay, Terry, when you dial 211, you will get a call center counselor. And I want to back up a minute and go back to what Marguerite said about us being a blended center. What that means is that all of our call counselors are trained not only to give you information and referral, but also to do crisis counseling. We find that a lot of times people get in crisis because they have not been able to access the information and referrals that they need to get the help. And sometimes people that are just calling for information and referral, we find that that person truly is in crisis and needs some intervention, and we can assist that way.
I would say you listen, you can, being trained, they can hear that in the voice. So
They can hear
although
that in
I
the
or
voice.
whomever say they were calling for, I need this or I think I need this, that other person may detect that they need a bit more and they
Right.
need some of that caring conversation to
That's
get a
right.
better handle on what's going on.
Yes, that is right. So some on the line counseling can occur then. A follow-up can happen to that call. It is evaluated and the needs are addressed. One of the first things they find out when you call is what's your zip code, so that could pull up for us the resources that would be available in your area as the counselors talk with you about what your needs are, so that they can then share with you what's available within your zip code or other zip code areas that would service your area. We have a great resource manager that is constantly mining for resources. We ask the community to share with us resources that they may be offering on a short-term or even a long-term basis, so that we can get those in our database to share with our callers. But that is something that is ongoing daily, is the updating and the looking for resources within the 10-parish area we serve.
And describe that, if you will. I've been to the VA-Link call center, and it's amazing. It's computers and people, and they've all got their headsets, their
Headphones and
earbuds. They're all
speakers.
ready, but it's just constantly going and changing and moving, because it is in real time trying to keep up with what's going on in the community.
That's right. We are staffed 24/7. We use a great database service to help us keep things updated and to cue us when things are going out of date. We have a great telephony in answering the phones. If we have too many calls and need the help of another 211, we can enlist them to help us, and vice versa. And as in disasters, we all function as one within the state and help each other out, which is very unique.
I was going to say that's what if I want to come back to that, but just closer to home right now, we see how our population is changing, and we have an influx of people from other countries, from other parts of the country. Some aren't familiar with what to call for or what they need or just what to do, period.
Right.
So that's a very important point.
211 is great for them, too. We use a service that will allow us to have language translators on that will serve 152 different languages. So there's no reason not to call 211.
And that's something that we really, really are working hard on because we know we have so many divergent populations now. And when you're saying the telephony, also makes me think of those who have are deaf,
Right.
may have hearing problems.
Right.
They can
do
access you as well.
That's right. We do have that service also.
But when you talk about, boy, the reach that you have by joining together, the power of being united and having all the different 211 systems in the state, how many are there and how do you work together during times of crisis?
Well, there are currently 5 211s in the state, and in northwest Louisiana, a new one will be taking the place of one that has been there in the past. However, during disasters, we provide statewide coverage. Over the past several years, for the most recent disasters, the governor has gone on mass media and said, dial 211 to get up-to-date information related to whatever disaster it is. It could be information on shelters, sandbags, and anything that is needed in terms of a disaster. So it's really critical information that is being looked to. And that means that for us and for for the other 211s in the state, we have to have, and for us, we have had extensive plans since before Hurricane Katrina for relocation of our services to other call centers. In our case, we have a standing arrangement to relocate to the Baton Rouge Crisis Intervention Center, which operates the 211 for that 10 parish area, or as we relocated during Katrina to the United Way of Northeast Louisiana, which operates the 211 service for that area. So our relationships with other 211 agencies, as well as partnerships with their local United Ways, all of whom we know well because we've worked together so long to provide this vital service, we're well equipped to relocate in disasters. We also now have a degree of technology that, of course, we did not have during Katrina. And we not only relocate some of our key staff and counselors and resource people during hurricanes, we also have counselors who are able to work remotely and others who can come in to call centers in Baton Rouge. We actually have employees who live in Baton Rouge and outer areas who can go to the call center, and others who have the capacity to work from home. And then we have our partners at the other United Ways in the state who can help us with calls.
And I think it's amazing because should weather or other horrible circumstances come to play, I mean, we're talking crisis here. As you said, if you have to stop and get out, evacuate, whatever, the fact that it can continue this service and help each other so many. Now, I know there's always been talk, and this may be in the future, that even roll over to some of the other Gulf states, because I know during one of the last evacuations, having the service here of 211, but then crossing into Mississippi and going up that way and hearing them on air the entire time, giving directions to all those of you who are coming in from the New Orleans area, please be advised. And it was amazing that I just saw this partnership, and I think about what 211 can provide to this country, and it's just amazing.
One thing, I serve currently on the 211 U.S. Community Disaster Response Task Force, and the changes that have taken place over, let's say, the last 10, 11, 12 years is phenomenal. We used to send teams to places that had been affected by disasters. When I say teams, I mean the United Way Worldwide and our national affiliate, the Alliance of Information Referral Systems. And we've had via link 211 staff members actually go to the wildfires in California and work at 211 San Diego and the floods in Iowa to Des Moines and so forth. Now everything is handled electronically. During Gustav, the Louisiana 211 system was so overwhelmed with calls, and we didn't want people to have to wait a long time. And so we just picked up the phone and called our partners, 211 San Diego, who then involved the 211 in Los Angeles and San Francisco to help take overflow calls. Now, the problem was because the people in California were not able to understand the people calling from Louisiana, so they had to call in alums from local universities to answer calls. But I think this says how resourceful we are, as well as the phenomenal technology. I was just on a call last Monday morning on this National Community Emergency Response Task Force, and on the call was the head of Vermont 211, which is a United Way statewide supported organization, as well as the head of the 211 in Philadelphia. And both had been so heavily affected by the tremendously impacting storms of snow and ice and sleet. And the guy from Philadelphia said they were overwhelmed. They had the Super Bowl. They were on call for that. Then they were handling all these ice storms, and all the trees had so much ice, the branches were falling down. 911 couldn't answer those important but non-emergency calls, so that 211, without thinking of the huge expense, they were handling 911 calls. Now, I'm not saying we would handle 911 calls here, but what I'm saying is that 211s around the United States, and for sure within our state, will do anything and everything we can to meet the needs of the citizens of the state, and we do it in close partnership with the United Way.
And that's it. You're trying to get answers, get help. And by saying what you did about 911, maybe we should go back and revisit a little bit of the numbers, because we talked earlier about 211. Here we are. We are social services. We are going to help you with your problems. You are also operating it as a crisis line for those who are in
the 911 for health and human services related issues.
Yes. And you've got 411, which is just information, and that usually means how do I get in touch with so-and-so at such and such an address. Then you've got 311, which is for the city. You've got all these things, but and then 911, which is usually, again, it's for police, fire, ambulance, those type of emergencies.
And we do work with 911s. If we have a caller in crisis, severe crisis on the phone, we will keep them on the phone while we get 911 on the line with us.
And that is a little bit I want to talk about, because I know on the North Shore in St. Tammany Parish, you've been working there because they have had such a high suicide rate. And for the last several years that you've been an integral part of that, and working with United Way, VOA, the parish government, and others to try to help the citizenry there.
Right. St. Tammany has for a while had one of the highest. They do not have the highest, but just one of the highest rates. Overall, about 20% of the calls that come in to our call center are crisis suicide related. If you're looking by parish, about 28% of those coming from St. Tammany are crisis suicide related. So a lot of our time in counseling assists that parish, and from time to time, St. Bernard and other parishes, their rates get very high too. So it's a great service for us to offer, and I don't know if you're aware that we also answer the lifeline numbers, the 1-800-SUICIDE or the 1-800-273-TALK. Those numbers, if you're calling from a 504-985 or 337 area code, those come to our call center, and we work with those too.
I think what's also so amazing about 211 is some of the other partnerships that are developing. I want to go back and talk about how United Way and 211 are so involved, but the opportunities that come up, again, I'm going to reference, I think, what you did, Marguerite, and you're talking about the oil spill. Knowing that there were a specific amount of particular parishes involved, and that there were particular government agencies or here or there, and trying to connect people, that you can be so specific as to work in just one location, whether it be in St. Tammany for one kind of program, and it's okay to talk about it, down to the coastal parishes when they were really feeling the effects of the oil spill on their businesses, on their personal lives. It's nice that you can get right in there, identify it, and then go to work with the right agencies.
We work in close partnership, and I know one of your other partner agencies is the American Red Cross. And when the oil spill happened, Kay Wilkins, who is the CEO of the local Red Cross, called and said, would you like to go down with me to see the resources that have been quickly put up in Plaquemines Parish as well as St. Bernard Parish? So just very early on, we went down to see all the resources that the Catholic Church, Red Cross, and other key agencies had developed down there. So having close relationships with the United Way, the Red Cross, as a matter of fact, we can even relocate during the disasters to the Red Cross facility that was built to withstand a very strong hurricane, which is on the North Shore. And so we work very closely with our community partners to kind of to assure that we can respond in every possible way to the community.
And again, I think that's great. You adapt to the needs as they become apparent and work with that particular area up and until. And the reason I'm thinking about this, there were grants, there were government agencies and others doing specific actions or programs or providing services, but for a limited period of time. So when you were talking before about how you constantly updating, you know when something's getting ready to phase out, and now maybe they need to be, the people, the callers need to be directed in another way to someone else or something else that can provide assistance.
And Terry, too, we do collect some basic demographics from our callers, and we do keep track of the needs and the types of resources that people are not only calling about, but are being referred to, and then even those unmet needs, resources that are needed but are not out there. And we do have those reports, and we do provide those reports to agencies that request them. We can see trends and needs before maybe the parishes themselves may see them. Like for a while now, we've been tracking parishes that have their needs for housing and shelters has been increasing. And, a lot of that is just the decline in the financial stability of the family unit.
Well, in fact, I was going to bring up in some of the research that I was doing for 211, your top call center needs for last year, for 2013, right at the top, basic needs, housing. Right. Number 2, mental health care and counseling, which we're just talking about, and those two can often go hand in glove. I think anybody who didn't have safe and secure housing would become very upset and would need to want to talk to somebody from time to time. Then you've got other community services and public assistance, individual and family life, which could go back to some of the things you were talking again about in terms of maybe children or needing some there, how to get along better, specialized, sure, health care, criminal justice and legal services. This one was interesting to me, consumer education and protection. Now, I that's one I hadn't heard of, and I might want to come back to that. Employment services, again, and I think that just referenced the same thing with our economic stability being what it is. It's a challenge here.
Right, it is.
For all the indicators we have that we're robust and we're coming back and all these things, then on the other side, we keep hearing about people, maybe even friends and family members that we know who are now being downsized. So it's a give and take, push and pull situation. And then lastly, but not leastly, again, the disaster services. And I think that was because it was a relatively, let's say, knock on wood, should I do it up here, that we had a relatively mild storm season.
Right. Terry, one of the recent trainings our call center staff got was on bullying. We were seeing more and more calls coming from youth who felt that they were being bullied, calls coming from parents looking for resources or someone to talk to. They just didn't feel they were getting anywhere. The training was great. We had Roger Dinwiddie from the National Association for Anti-Bullying work with us. And so it gave some very basics in working with callers to first define what bullying is. Sometimes everything gets lumped into bullying that might be just some normal development in youth. We're a different society now. We don't get out and build those relationships hanging out in the front yard anymore. A lot of that's electronic now. So, that makes different issues arise. But great, it was great training.
And again, I think that points out just how adaptable you are. You're ahead of the curve on so many of the things, being able to see by the calls that you're receiving what these new trends might be, but then keeping up with this phenomenon of bullying, which I think has always been around, but it just seems like it's gone to new heights, and just cruelty, and what it can do to a child, and how it could really ruin his or her look at themselves through life. It needs to be discussed. I want to go back for just a moment. You were talking about some of the calls by parish, and you can break it down, and my goodness, we only have about 5 minutes left to talk, but this is just so important too, because you were talking about the demographics, and it does give a good example of who and what, and some of the largest. Orleans, and I guess again, because we're the most populous of the parishes, we account for about 35% of the calls, but Jefferson is right up there too, as is St. Tammany and Tangipahoa, and a lot of the others. So within your calling district or distance is larger than our 7 parish service area of United Way, but it extends into the service areas of other United Ways, which again brings together this partnership and how we're covering everyone. And it's amazing just to see how many people have availed themselves of the services. So your goal, I would imagine, is that one day nobody has to call because we're all living a wonderful life and everything's great. But until then, it's nice to know that 211 is there. So what can people do? How can we get the message out? We keep telling everybody 211, 211. What are some other things you want people to know? Because I consider you heroes. I know during the hurricanes that you have helped people be taken off their roofs after they've been sitting there for days waiting for help. There's so many things that you've done. You've talked somebody down who is contemplating suicide. So the folks at ViaLink 211, I really have to give you kudos because what you do is so, so important in this region. And with a few minutes left, what are your aspirations? Can you tell and share with the listening audience today what you hope that will happen and what maybe they can do to help, if anything?
I would be happy to do that. One of the main ways you can help those of you out listening to the show would be to support the United Way, either as an individual or to have a workplace campaign. Our biggest challenge is not quality of service, it's not demand for our service, it is long-term sustainability. And one of our major partners is the United Way of Southeast Louisiana, and we ask that you contribute and help make this service possible and ongoing, and one that grows and grows with the needs of the community.
And Lavondra, anything to add?
Well, I'm going to go back to accessing the service too.
Please.
As you can see, our demographics show it is the women by and far that will call before men will call. And the typical age range is between 25 to 40. So we've got to get the men out there to call and ask for help before they get into crisis too. And everyone just share the number.
And it's so important. Our friends and partners at Family Service of Greater New Orleans, it's a cultural thing. It's a national, it seems to be everywhere. Trying to get men to realize it's okay to talk about it, to ask for help, to call 211 and get put with someone who can provide the services they need. So ladies, I tell you what, I just can't thank you enough. We know call 211, but there's also a website if people want more information, isn't there?
Yes, there is. It's www.vialink.org, VIALINK.org.
And if anybody has a question that's non-crisis, and do they still call 211, or is there another number you prefer they use?
If it's a non-crisis and they just need information and referral, still call 211.
And that'll still get them there. But I mean, they wanted to talk to one of you ladies or something like that.
Oh, sure. You can email us at info@vialink.org, or you can call
504-895-5575.
Otherwise, folks, we're going to say it again one more time. 211. And that's the ViaLink, easy to remember, 211 telephone number that can help you in times of need and crisis. ViaLink, one of United Way of Southeast Louisiana's community impact partners. I want to thank you for joining us today, Marguerite Redwine, who is the CEO of ViaLink 211, and Lavondra Dobbs, who is the Programs and Services Director for ViaLink 211. She's the gal that's got that call center really working. So again, anybody out there need any help? Can we say it enough? 2, 1, 1. Call it. You'll be glad you did. Thanks for joining us today. I'm Terry Westerfield. And for United Way, live united.